Hi there, my name is Dustin Cavanaugh, and I'm going to be taking you through my neurology slides. So when we look at the neurophysiology, one thing that we really have to consider is a lot of the gray matter is going to be conducting at a little bit of a slower rate. These will depolarize through potassium-sodium channels, and when that excitatory wave is transmitted through biology of the neuron, we have to think about it as a single unit. And one of the important features of a myelinated axon. So when we look at the myelinated axon, we have saltatory conduction. It's going up fast. It's supposed to be smooth, and we want a signal transmitting at about 150 meters per second. One thing that gets thrown off is the ability to learn. It's the ability to make new connections and also maintain the connections that are there. So one thing that we can do is we can prune those connections. When we're learning new things, we gather it all, and then we start splicing out what's important and what's no longer important. One thing that happens is visual changes, and that's just issues with your sensory organs. When you decrease your sensory input, that'll create issues where we see shrinkage because we've got less sensory organs pushing less amount of sense to the brain. As we age, we see plaque formations. Alzheimer's is a disease that is not technically diagnosed until the person's dead. We don't know what's going on in that brain until we make a slice. So some of the other issues we see are with autoimmune disorders. Those will attack things like our oligodendrocytes, our Schwann cells. A lot of these neuroglial cells get taken down by an aggressive immune system when we look at things like MS. So one of the problems that we face with our patient population, this embolism travels in and blocks one of the crucial areas of our motor cortex, perhaps our sensory input, maybe our neck, our head, shoulder, and our arm. So if we get one on the right side of the body, what's going to happen is it's going to transfer into left-sided paralysis. So that's one thing that we have to consider in our patient population, and always be on that strong side. So always keep in mind best practices. We don't want our folks falling and having a issue on top of the issues that they're already having to face on a daily living. So we've got Tova here taking the best care of one of our patients. The things that we worry about with stroke, risky behavior, smoking, definitely bad stuff, exposure to heavy metal, every now and then, isolation. We see high sugar create diabetes issues. Alcohol use can create issues. UV can create damage. It'll oxidize, and that can cause cancer and transfer to the rest of the body. We have predisposition due to our genetic factors. Risky behaviors like riding fast things on two wheels. When we talk about traumatic brain injury, also known as CTE, basically what's happening is somebody has injured their brain, and a lot of times when they're not wearing a helmet or doing high-risk activities, you can injure the brain can swell. Now that can affect your motor cortex. It can affect different parts of the brain that translate to different impairments throughout the body. Now, I got a friend, Dominic, who's headed to Race Wars. He drives a Honda B2000, and sometimes he drives a little too fast with his headphones on, and he wasn't paying attention and forgot to wear his seatbelt. Oh no, Dominic just got a brain injury.
This is your medulla oblongata.
Okay.
Here's your cerebral cortex.
All right.
And here's a spine.
Oh wow.
Yeah, I made it this personally, so I know the yeah.
All right. Well, thanks for your input there, Dominic. His brain's just not what it used to be. Well, hang in there, Dom. We got you, buddy. You always want to be wearing a helmet. These greasy foods can create those plaque issues. And of course, alcohol use can create issues as well. So when we move into the common disorders, we see peripheral neuropathy, often associated with diabetes. We see epilepsy. One of the biggest concerns with the medications that we're using for epilepsy is you really decrease the firing in the brain. So when you decrease the firing in the brain, it's going to decrease the chance and the incidence of having an epileptic seizure. One of the problems with those medications, along with a lot of other neuropathy pain drugs, like gabapentin, you're going to slow the firing of the brain, and that means the patient becomes a fall risk. That's where you can see a lot of these issues happening. General delirium, dementia is pretty common, and stroke's going to be really something that we worry about with these folks. So what's a geriatric to do? Good nutrition is important.
You want to take the test the temperature of that first? Is that warm enough?
Yeah.
Okay. All right.
With having slowed neurology, slowed firing, a lot of times we can lose our reflex around the hypoglossal nerve, and we can create an aspiration issue. We want to promote the patient's independence. Hydration is important. We want to stay active with great range of motion. Hearing devices is important. Of course, we love our music therapy with our elderly. Reminiscence therapy is important. And a fall risk was really something to consider. So one thing that I would really emphasize.
Commode, a bedside commode.
Okay.
Also known as a toilet, right?
All right.
So you have your bucket in here, usually. Should be somewhere. It's up there, near the sink. Anyhow, so it offers a nice mobile way to transfer your patient's toileting needs right next to their bed.
All right. Well, you heard it from the source. These devices can really save somebody from a fall. So consider what happens when somebody falls. We have skin complications, and his fall ended up leading to his death. So I think it's really something to consider when we think about who we are taking care of and treating them like family, because our patients, they are somebody's family. It's really important that you just maintain a high quality of life, no matter what the quality of function is with their neurology.